Hi, my name is Dr. Jacobs. I'm a doctor of physical therapy, advanced clinical nutritionist, and inventor of ASTR. After my second cancer treatment, I used to suffer from chronic pain, migraine, headache, fatigue before I invented ASTR's specialty. All right, Lori, tell me what's going on with your back. What happened?
I have a little back pain on my left when I stretch forward.
How long has it been going on?
6 months.
6 months. How did you hurt your back?
Working.
So you're working with the patient. You're a physical therapist,
yes, I felt just a little, like nothing, but it just like a little stretch.
Little stretch. So have you had any treatment on your back in the last 6 months?
I did myself, of course.
You worked on yourself?
I worked on myself.
Yeah, that's difficult, yeah.
Well, you can do a lot.
Yeah.
Economics and just stabilization. Of course, I went to my colleague, physical therapy, but didn't know how to manage really in between, so it got worse and worse. It gets worse and worse.
Can you give me a little bit background? You're a physical therapist. Were you practicing? And
I practice in my own practice. I work like 6-7 hours a day, 4 days a week.
Where are you from?
Switzerland.
Welcome. Yeah, use it as a vacation here.
Yes.
It's beautiful here. Yeah. So, how much pain do you feel in your back, and what can we do to aggravate your symptoms?
It's got really much better. Now I can. I have a little pain on my low back when I stretch forward.
0 to 10, how much on average? So it's
like when I do any, I don't like now. I don't feel anything.
So when you bend forward,
it's just bend forward. I feel a little.
Okay. Any other motion that aggravated squatting or?
I don't think so.
Okay. So we're gonna do the motion that's aggravated and give me a number and the location, but no sharping going down to.
Nothing in the leg.
It's more likely lower lumbar. Is that correct?
Yes.
Okay.
Yes.
Glute or just lumbar?
Just lumbar.
Okay. So we'll have you stand up, marking your legs. How far you go down and how much pain.
And now I have a little 2 on the left.
2 out of 10?
Yes.
Okay. Let's extend. You're very limited there.
I have a little pressure, but not much.
Okay, can you do twist left and right and see how much?
Little stretch, muscular stretch around.
But no pain, yeah?
No pain, just around the ribs.
Okay, side bend left and right.
Okay, just a feeling here. Stretching, but no pain, just a stretch.
So it's most likely with flexion, yeah?
Yes.
Let's do the flexion again. I want you to... And suck your stomach in. Is that aggravated? Mark on your legs how far you can go. So this way we can use it as...
It doesn't aggravate.
I will slide your arms on your legs so we can... Yep, it's the same position. Okay. So it's the same, yeah?
It's about the same.
Okay. So it's your left or right? In the back?
It's left.
It's the left. Are you comfortable lying your stomach?
Yes.
Okay, so we'll have you lie head over there. And I'll put this behind your legs. Okay, and you can make sure everything pain-free. So when you feel it in the left lumbar area.
Yes.
Okay. Is that painful?
No.
Here?
A bit.
So it's you feel it right in here, yeah?
A bit.
Painful?
A bit.
Here? Here?
Here more.
Here more? Okay. Here?
No.
Okay. Anything in the glute area here?
A bit.
Make sure it's not painful, okay? It's right on the spine, yeah? So you took the online course, yeah?
Yes.
For providers.
Yes.
So do you feel what I'm doing now?
Yes.
Does it make sense what I explain in the course?
Yes.
So you feel how much tightness in your apparatic fascia here?
Yes.
Okay. So I'm using the A1 now. Okay.
Yes.
I'm gonna use the A2. So it will make sense to you why I'm using the CC.
Yes.
I can go deeper here, and because there's more curvature here. But it's like here, the pain?
Yes.
Okay. So have you ever been able to touch your toes
Yes.
before this happened? Or a while
yes.
ago?
No, before.
Before this happened?
Yeah.
So that's actually a good functional goal to be able to touch your toe. Okay. So I'm not going to use the Magna Heel to make sure there is no localized inflammation. I will use everything else.
Yes.
And then see how is your range of motion. If it's back to normal, that's mean you're purely stuck in a proliferation stage in that area. If not, I'm going to use a Magna Heel afterward, okay?
Yes.
Okay. It's going to feel cold, okay?
Yes.
You feel that fibrosis here?
Yes.
Okay. It's right on your iliac crest here.
Okay.
It's a very common area for a low back. And here. Is that sensitive or it's okay?
Sensitive, but no pain.
No pain, okay. It's not too bad here. This is very fine, like nothing here.
Yes.
You have a little bit in here, but this, yeah. See how much deep I'm going?
Yeah.
Mm-hmm. It's not too bad here. It's all actually in your iliac crest. Yeah, or you feel it on the side too?
Here I feel it a lot.
Hmm?
Here I feel it a lot.
Like around your iliac crest, not quadratum mamborum. Is that correct?
I feel it just like here. Sensitivity. Yeah.
Sensitivity, but did you notice most of your scar tissue on that spot?
Yeah.
You know, that, so,
It's, yeah. Vibrating.
so when you go back, you know, you can, I don't know, you can have someone use the A3 to work on you
Yes.
in that spot.
Yeah.
Is that too much?
No.
But you see that when we go to the glute, you get more.
Yes.
Sure. Is that too much here?
No.
But you feel it?
Here,
It's
oh my god, here it's too much.
sorry. So that's, I mean, a little bit inflammation here.
Yeah.
So basically, we need to really get all your glutes. And let me see if that's enough or we have to do your hamstring, but you know what I mean? Because you don't have a shorts now, so we'll see. So let's set up for me. I will have you drink some water. And so we're gonna do the same motion, flexion. And just mark on your legs how far you can go down and how does that feel?
No more pain.
It's gone?
It's gone.
Okay, let's do 5. We'll have you do all the range of motion just to feel. How's that feel? How's that?
Bit better.
Gone or is still tightness?
I feel a bit in the hamstrings.
In the hamstring because we did not work on it. So we need to work on the hamstring. So let's do the twisting and but that area that you complained of we're fine, yeah?
Yeah.
And side bend and extension.
It's better.
Mm-hmm. Yeah. So your hamstring are tight. Yeah, focus on this. So what do you think about the ASTR treatment now? Just
for my practice
mm-hmm.
and for
just working on yourself. Yeah.
For just yeah. Well, it looks effective.
Yeah. That's good.
So just like I didn't have a big pain, but still annoying though. So for now it's gone. So I'm
Yeah,
happy.
you want to work a little bit more on the scar tissue
Yeah,
in that spot.
I can do that.
Yeah, that's awesome. Yeah, thank you so much.
You're welcome.
Thank you.
you.
Take charge of your health today by signing up for one of ASTR's free online treatment programs. Just click the link on the screen. To become a patient or to purchase ASTR tools, click the link on the screen. If you would like to become a certified ASTR provider, click the link on the screen.